Jack, thanks. The doctor is in. Dr. Michael Kuhlenschmidt from Christie Clinic is making the rounds this morning. Good morning. Thanks for being here.
Thanks again for having me.
So October is Talk About Your Medicines month, right?
Absolutely.
So that's what we're going to do. So what is important to remember about what you might have in your medicine cabinet?
Sure. So I think the most important thing as we get to the holiday season, and some people might choose to have, enjoy a glass of wine, maybe a Oktoberfest beer for Halloween, is to understand how alcohol can affect your medications. So it's a really important topic because medication interactions with alcohol are quite common and can be very serious. So I think a lot of people understand some of the medications that might do this, pain medications, things like that. But even common prescriptions like antibiotics, medications for blood pressure, medications for arthritis, can interact in a way with alcohol that certainly is not what we want. So
Sure.
I think the most important thing is to decrease the amount of alcohol that you use when you're on a new prescription medication or prescription medications that you've been on for some time. So the problems with alcohol can be everything from the medication won't work as well to dizziness, lightheadedness, nausea.
So additional side effects, really.
Absolutely.
Yeah, so it's important to think before you drink while on medications, I
Yep.
guess is the phrase.
Exactly.
You know, what else is there to avoid or think about, you know, as far as using our medicines safely?
Yeah, absolutely. So in cold and flu season, another thing that I think is always worth reviewing is over-the-counter medications that may have a brand name but have multiple medications in them. So Tylenol is an important one. The obviously generic here is acetaminophen. So looking at the labels of the medications before you take them and knowing how much Tylenol is in them so that if you're taking regular Tylenol or multiple medications that have a Tylenol component, to know that you're taking a safe amount. And it's always important to review with the doctor or your pharmacist about what safe Tylenol levels there are and what might be in your medications that you get both prescriptions and over the counter.
Absolutely. So whether it's prescription or over the counter, whether it's name brand Tylenol or a generic brand form of acetaminophen,
Exactly.
You've got to look at the quantity of it to see, is this 200 milligrams? Is
Right.
it more than that? That's kind of what you have to be on the lookout for.
Exactly. And then always talk to your doctor about in your specific situation, what's a safe Tylenol level for you? Because it is a little bit different based on age and based on your health conditions.
Absolutely. So we're talking about, you know, think before you drink. Besides that, be aware of the dosage. You know, going from different brands of medications or maybe prescription versus over-the-counter.
Right.
What other tips do you have that, you know, we can use to make sure that we are taking medicine safely?
Absolutely. So oftentimes when your doctor starts you on a new medication, they're going to have conversations about what to expect, side effects and things like that. But anytime you start a new medication, there's always a risk of a side effect that we can't anticipate. And so what I recommend to patients, and I think is just a good tip in general, is when you're starting something new for the first time, take it in a controlled environment. Don't take it right before you're going to go on a road trip or right before you have something important to do or you're going to operate machinery or have something important to do at your job. Take it in a controlled environment at home where family or friends can be around you so that you know how this medication will affect you. Even simple things like antibiotics or other medications that we don't commonly describe serious side effects. Anything can happen to anyone at any time. So when you're starting something new, do it in a safe environment where someone can be there to help you if something happens.
Yeah, that's very good advice. A lot of people may not think about that.
Right.
Do it at home when you have friends or family around. You have access to any kind of help that you might need.
Absolutely.
All right, Dr. Kuhlenschmidt, thank you so much.
Thank you.
We'll be right back with more of The Morning Show right after this break.